So, MS Ortho yung topic natin. First, magpo-focus tayo sa anatomy. So, merong 206 bones found in the body. 206 bones, divided yan sa 4 categories. 4 categories. Ano yung 4 categories na yon? Always remember, ilan yung bones sa body? 206 bones. Meron tayong long bones, short bones, flat bones, and irregular bones. Guys, focus muna tayo dito sa anatomy ng ortho, sa basic knowledge. So, yung 206 bones, composed siya ng long bones, short bones, flat bones, and irregular bones. Ano ba tong mga long bones na to? So, yung long bones, designed siya for weight bearing and movement. Yung short bones, consist siya ng cancellous bone covered by a layer of compact bone. Yung flat bones naman, important site siya ng hematopoiesis, frequently protect vital organs. Irregular bones, meron siyang unique shapes related to their function. From the words itself, pag long bones, mahaba. Pag short bones, like, pag flat bones, like skull. Pag irregular bones, unique shape siya. Okay? 206 bones composed siya ng long bones, short bones, flat bones, and irregular bones. Now, meron tayo 3 types. 3 types ng bone cells. Ano yun? That familiar kayo dito. Number 1, osteoblasts. Number 2, osteocytes. Number 3, osteoclast. From the word itself, osteo, bone, ano ba yung osteoblast? So, yung osteoblast is function in bone formation by secreting bone matrix. So, yung osteoblast natin is nagmi-make siya ng bones. Yun yung keyword, make bones. Well, yung osteocytes natin, mature bone cells na involved sa bone maintenance and located siya sa lacunae. Lacunae. Ano ulit yung purpose ng osteocytes? From the word, it's pag blast, osteoblast, gumagawa ng bones. Kapag osteocytes, involved siya sa bone maintenance. Okay? Located siya sa lacunae. Yun lang yung dapat yung tandaan. Pag osteoblast, blast, nagme-make ng bone. Pag osteocytes, for bone maintenance. Ano naman yung osteoclast? Ito yung multinuclear cells involved sa dissolving and reabsorbing of bone. In short, nagdi-dissolve siya ng old and damaged bone. Yan yung 3 types of bone cells. Bone cells yan, guys, ha? Pag osteoblast, make bones. Osteocytes, bone maintenance. Osteoclast, dissolve old bones and damaged bone. Ngayon, dito naman tayo sa part of the bone. Focus muna tayo sa anatomy ng ortho, okay? Sa parts of the bone, meron tayong parts of bones. Ano yung mga yon? Parts of bones. Meron tayong number 1, osteon. Ano yung osteon? Ito yung microscopic functioning unit ng mature cortical bone. Ano naman yung periosteum? Ito yung dense fibrous membrane covering the bone. Guys, hindi nyo naman kailangan i-memorize ito. Need nyo lang maging familiar. Intindihin nyo. Pag endosteum naman, thin vascular membrane na nagko-cover ng marrow cavity ng long bones and spaces sa cancellous bone. Meron tayong, alam ko familiar kayo dito sa isa, bone marrow. Ito naman yung vascular tissue na located sa medullary cavity ng long bones and in flat bones. Meron tayong number 5. Bibigyan ko kayong picture para maging familiar kayo dito. Epiphysis, cartilage, and diaphysis. Okay, so ito yung part of bone. Ayan, kung makikita nyo, yung diaphysis, shaft siya ng buong bone. Ayan. So, first, diaphysis, ito yung shaft of the long bone. Ito yan. Shaft. Diaphysis. Ito mismo. Itong, yan. Ang cartilage naman, ito yung tough, elastic, avascular tissue na nagko-cover sa end of long bones. Cartilage is a tough, elastic, avascular tissue na nagko-cover sa, ayan, long bone. Cartilage. Ano yung epiphysis? Ang epiphysis naman is ends of the long bone. So, meron ka ditong proximal and distal. Epiphysis, ends of long bone. Ang bone marrow, meron ka dito. Ayan. Ito yung red bone marrow. So, ito yung vascular tissue located sa medullary cavity ng long bones and flat bones. Ano yung endosteum? Perosteum. Pag endosteum, thin vascular membrane cover the marrow cavity of long bones and spaces on cancellous bone. Pag perosteum, dense fibrous membrane. Okay? Ito yung perosteum. Yan yung dense fibrous membrane covering the bone. Samantalang yung endosteum naman, ito ay thin vascular membrane. Membrane covering the bone. Ulitin natin, pag endosteum, thin vascular membrane. Pag perosteum, dense fibrous membrane. Yan yung pag osteon, microscopic functioning unit of the mature cortical bone. So guys, osteon, perosteum, endosteum, bone marrow, epiphysis, cartilage, and diaphysis. Yan yung part of bone. Always remember, kapag epiphysis, ito yan, nasa taas siya ng long bone. Proximal and distal. Kapag diaphysis is shaft naman siya. Ito siya. Always remember lang, tandaan nyo lang yung basic part of bones. So, meron naman tayong bone formation. Ang bone formation natin, meron niyang two kinds. Meron tayong osteogenesis and ossification. Ang osteogenesis, ito yung bone formation begins long before birth. So, nagsisimula siya bago ka pa ipanganak. Bago ka pa long before birth. Bone formation begins long before birth. Osteogenesis yan. Ano naman yung ossification? Ito yung process by which yung bone matrix natin is formed and hard mineral crystals composed of calcium and phosphorus are bound to the collagen fibers. Isa pa, ito yung process kung saan yung bone matrix natin ay nabubuo and yung hard mineral crystal ay composed ng calcium and phosphorus na bound sa collagen fibers. Okay? Ito yung process kung saan nabubuo yung bone. Ossification, process where bone matrix is formed. Okay? Pag osteogenesis, nagsisimula pa to long before birth. Ito yung itsura niyan, osteogenesis. The development of bone long before birth. Ayan. Kapag ossification naman, yan yung formation of bone. Kasama yung calcium and phosphorus. Ayan. Ossification is the term used to describe a process of bone formation by deposition of calcium in the fetal hyaline cartilage. Okay? Yung all bones develop from the mesenchymal tissue of embryo. Kapag ossification. Okay? Lagi nyo tatandaan tong word na to. Osteogenesis. Ossification. Okay, balik tayo. Ano yung mga part of bones? Meron tayong osteon, periosteum, endosteum, bone marrow, epiphysis, cartilage, diaphysis. Kapag periosteum, dense fibrous membrane. Pag endosteum, thin vascular membrane. Pag cartilage, dito siya madalas makikita. Tapos pag diaphysis, ito yung shaft ng bone. Ayan yung diaphysis. Pag proximal naman, nasa ahead ng long bone. Pag osteon, microscopic functioning of the mature cortical bone. So, ano yung 3 types ng bone cells natin? Lagi nyo tatandaan, lahat yan may osteo. Pag blast, nagmimake ng bones. Pag cysts, natatagpuan niya sa lacunae, bone maintenance. Pag class, nagdi-dissolve siya ng old and damaged bone. Blast, make bones. B, para maalala nyo, blast, make bones, born. Kahit mag-ano tayo, pag classed, nag-classed sila, destroy, dissolve. Yan, okay? Pag osteoblast, born, make bones. Pag osteoclast, nag-class sila, dissolve, damage bone. Pag osteocytes, lacunae, osteocytes, bone maintenance. Yan. Ilan ulit yung bones natin? 206 bones. Meron tayong long, short, flat, irregular. Long, short, flat, irregular. Basic lang yan, guys. Di nyo naman kailangan i-memorize. And pinaka-importante sa PNLE board exam, alam nyo yung basic. Pero, mostly mag-focus kayo sa mga yung kaya nyong gawin as a nurse. Nurse management. Okay, etong anatomy na to, inano ko lang yan para alam nyo yung basic. Baka nakalimutan nyo na. Okay? So, na ngayon, dito na after ng bone formation, focus na tayo sa bone maintenance. Tapos na tayo sa bone formation, osteogenesis, ossification. Ngayon, dito na tayo sa bone maintenance. Ano ba yung bone maintenance? Meron tayong 2 kinds. Meron tayong remodeling and reabsorption. Remodeling and reabsorption. So, remodeling and reabsorption. From the word itself, pag remodeling, ito yung primary process that occurs by early adulthood. Ito yung nagme-maintain ng bone structure and function through simultaneous reabsorption and osteogenesis. And as a result, complete skeletal turnover occurs every 10 years. Ang reabsorption naman, ito yung removal or destruction of tissues such as bone tissue. Alam nyo ba, may mga factors yan? Alam nyo ba, yung physical activity is nag-i-stimulate siya ng bone formation. Lagi nyo tatandaan. Yung physical activity, may advantages yan. Ito yung nag-i-stimulate ng bone formation. Yung dietary intake natin ng certain nutrients like calcium and several hormones like calcitriol, PTH, calcitonin, thyroid hormone, cortisol, growth hormones, and estrogen, and testosterone. May mga ayan din yung factor niyan, hormones. So, if meron tayong bone formation, meron din tayong bone maintenance. Okay? If meron tayong bone maintenance, meron naman tayong bone healing pag nagka-fracture or nasira. Bone healing. Meron tayong bone formation, bone maintenance, and bone healing. Sa bone healing naman, broken bones healed by a process referred to as union. Union takes place in series of steps. So, yung broken bones, nag-heal siya sa process, and yung process na yun ay tinatawag na union. So, merong different series of steps yung union natin. Number 1, kapag for example, nagkaroon ka ng fracture, para mag-heal yung bone natin, nagkakaroon muna yan ng hematoma formation. So, yung hematoma, yung blood nag-accumulate. Saan? Blood accumulates sa area ng break or injury. And then, yung extravascular blood, nagko-convert siya na sa liquid to semi-solid. Extravascular blood convert from liquid to semi-solid. Guys, dito pa lang tayo sa hematoma formation, ha? An active phagocytosis remove necrotic tissue and debris. Nagkakaroon niya ng active phagocytosis. Yan yung nagre-remove ng necrotic tissue and debris. Diba meron na tayong hematoma formation? Yung blood nag-accumulate sa area ng injury. Next is callus formation. So, yung callus formation is yung fibrin cells, nagpo-form siya ng network around the injured area. Fibrin cells form a network sa around ng injured area. And then, yung damaged periosteum ay nai-stimulate siya para mag-generate ng osteoblast, forming a new bony substances referred to as osteoid. So, ulit natin, yung damaged periosteum, nag-i-stimulate siya para mag-generate ng osteoblast. Ano ulit yung osteoblast? Born or make bones. And then, yung minerals, nagbibigin siya mag-accumulate sa network forming a collagen callus. Ano pa lang to guys, ha? Anatomy, bone healing, process na tinatawag na union. Hematoma formation, callus formation, and then yung next after ng callus formation natin is calcification process. Kasi collagen pa lang tong callus formation eh. Ngayon, calcification na. So, yung calcification, nagbibigin siya and nag-establish para ma-support yung injury. So, connective tissue proliferates. Across the site and usually completed mag-calcified within 6 weeks. Okay? Nakukomplete yan, mag-calcify within 6 weeks. After ng calcification, meron tayong remodeling process. Yung remodeling process, ito yung excess cellular material absorb at the bone resumes its pre-injury strength and configuration. So, yung remodeling phase natin ay na-enhance siya ng hulaan nyo, stress and exercise. So, yung complete remodeling ng bones natin can take ng 6 months to 1 year. Okay? Ulitin ko ha. Meron tayong tinatawag na bone healing. For example, nagka-fracture ka. Sa fracture na yun, may tinatawag tayo na union na process. Ito yung meron nag-occur na hematoma formation, callus formation, calcification, and remodeling process. Union yung tawag sa process na to ng bone healing natin. So, ang hematoma formation, yung blood natin nag-accumulate siya sa area ng break or injury. Yung extravascular blood natin, nagko-convert siya from liquid to semi-solid. And nagkakaroon tayo yung active phagocytosis, nire-remove niya yung necrotic tissue and debris. After ng hematoma formation, nag-a-appear na yung callus formation natin. Ang fibrin cells, nagpo-form siya ng networks sa paligid ng injured area. So, yung damaged periosteum is nai-stimulate siya. Tsaka kaya siya nag-generate ng osteoblast. Or ano yung osteoblast? Ito yung bone cells na nagke-create ng new bones. Born make bones. Okay? Yung minerals, nagbibigay na siya mag-accumulate in a network. Tinatawag natin collagen callus. After ng collagen callus or callus formation, calcification process na tayo. Ito yung nag-i-establish ng support sa injury. Yung connective tissue natin nag-proliferates across the site and usually nagko-complete makalcified to within 6 weeks. Nakakalcify siya within 6 weeks. So, after na makalcify na yan within 6 weeks, meron na tayong remodeling process. So, yung excess cellular material natin ay na-reabsorb and yung bone na-resume siya sa dati niyang strength, pre-injury strength and configuration. So, yung remodeling phase na to ay na-enhance lalo siya ng stress and exercise. So, yung complete remodeling ng bone natin ay 6 months to 1 year. Okay, ilang weeks yung calcified bone? 6 weeks. Ano yung 4 na types ng bone healing? Number 1, ano yon? Number 1, that is hematoma formation, callus formation, calcification, and remodeling process. Okay, gets na? Now, mag-move on na tayo sa mga articular system natin. Nagpo-focus muna tayo sa anatomy, So now, articular system naman tayo. Part pa rin siya ng anatomy ng ortho, Yung articular system, meron tayong joint. Ano ba yung joint? So, yung joint is a junction of 2 or more bones. Junction of 2 or more bones. Junction. So, meron tayong 3 klase ng joints. Meron tayong synarthrosis, amphiarthrosis, and diarthrosis. Number 1, synarthrosis. Ito yung mga joints na immovable. Hindi siya nagagalaw na joints. Synarthrosis. Example nito yung skull sutures. Next is meron tayong amphiarthrosis. diarthrosis. Ito yung limited motion lang. Motion. Number 3, meron tayong diarthrosis. Diarthrosis, ito yung freely movable joints. Okay? Yung amphiarthrosis, ito yung limited lang. Ulitin natin. Ano yung ulit yung tatlong kinds ng joint? Ano ba yung joint in the first place? Ito yung 2 or more bones junction. So, meron tayong synarthrosis, which is immovable. Hindi siya nagagalaw. Immovable. Yung amphiarthrosis, limited lang. Limited. And then, diarthrosis, ito yung freely movable joints. Pero, example ng synarthrosis na hindi magalaw, immovable, skull sutures. Ang example ng amphiarthrosis, limited motion. Example nito yung vertebral joints and symphysis pubis. Ano naman yung diarthrosis? Yung diarthrosis, meron niyang different kinds of joints. Number 1, meron tayong ball and socket joints. Ito, nagpipermit siya ng full freedom of movement. Full freedom of movement. Example nito ay yung hips. Movement. Example is yung hips. Hips and shoulders. Ball and socket joints. Next naman, meron din tayong hinge joints. Anatomy pa lang to ng ortho ha. Marami-rami rin tayong sakit na i-discuss. And management. Ang hinge joints, pinipermit niya ang bending. Pero, one direction only. Example nito ay elbow and knee. Kapag hinge joints, okay siya mag-bend pero one direction lang. Number 3, meron tayong saddle joints. Hindi nyo kailangan i-memorize to, kailangan nyo intindihin. Ano yung ball and socket joints? Full freedom ng movement. Ano yung full freedom movement ng joints na meron sa katawan mo? Hips and shoulders. Pag hinge joints, pinipermit niya yung bending pero one direction only. Example nun ay elbow and knee. Pag saddle joints naman, ina-allow niya ang movement. Allow movements in 2 planes, right angles to each other. At right angles to each other. So, ang saddle joints, ina-allow niya yung movements ng 2 planes at right angles to each other. For example, ito yung joint sa base of the thumb. That is saddle biaxial joint. Thumb. Okay? Next is pivot joint. Ano naman yung pivot joint? Ito yung characterized ng articulation between radius and ulna. Pinipermit nito yung rotation. Permit rotation for activities, for example, turning doorknob. For activities, turning doorknob. Okay. Characterize to ng articulation between the radius and ulna. Meron tayong number 5, gliding joint. Ito, allow siya for limited movement in all direction and represented by joints of the carpal bone in the wrist. Limited movement to sa lahat. Limited movement sa all direction. Nire-represent niya yung joints of the carpal bones sa wrist. Joints, carpal bones sa wrist. Okay? Yan yung 5 kinds ng joints natin sa diarthrosis, which is freely movable joints. Meron tayong ball and socket. Ball and socket joints, which is full freedom of movement. Example is hips and shoulder. Pag hinge joints, permit bending pero one direction lang. Example niyan yung elbow and knee. Pag saddle joints, allow movements sa two planes sa right angles with each other. For example, thumb, saddle joints yon. Kapag pivot joints, meron pinupermit niya yung rotation. For example, yung activities na pag-turn ng doorknob, pivot joints yon. Pag gliding joints, limited movement siya. Example nito yung joints sa carpal and bone trees. Lagi nyo tatandaan yung mga different kind of joint. Joint pa lang to, synarthrosis, immovable, kagaya ng skull sutures. Amphiarthrosis, limited motion, kagaya ng vertebral joints and symphysis pubis. Pag diarthrosis, freely movable joints, tas may different kind siya. Ball socket joints, hinge joints, saddle joints, pivot joints, gliding joints, lahat yan ay diarthrosis. Okay? So, meron din tayong important kinds part. Ano yung synovium? Synovium is a member lining the capsule. Synovium. Pag synovium, tandaan nyo tong term na to, membrane lining the capsule which secretes lubricating and shock-absorbing synovial fluid sa joint capsule. Ulitin natin ha. Ito yung membrane lining the capsule na nagsisecretes ng nagsisecrete siya secretes the lubricating and shock absorbing synovial fluid. In short, ang synovium ay nagsisecrete ng synovial fluid na shock absorbing and lubricating sa joint capsule. Synovium yon. And then, meron din tayong ligaments. Ano yun naman yung ligaments? Alam ko familiar na kayo dito. If yung joints is two kinds ng junction of two bones, ang ligaments naman ay fibrous connective tissue that bind the articulating bones together. Ito yung nagbabind the articulating bones together. Ligaments. Ang bursa naman, ito yung mga importante yung tandaan na term. Synovium, nagsisecrete ng synovial fluid. Ligament, siya yung nagbabind ng articulating bones together. Ang bursa naman ay sac filled with synovial fluid. Nagka-cushion siya, cushion the movement of tendons, ligaments, and bones at a point of friction. At a point of friction. Okay. So, in short, yung synovium is siya yung membrane lining the capsule, and most of all, nagsisecrete siya na lubricating, shock-absorbing synovial fluid. Siya yung nagsisecrete ng synovial fluid para sa joint capsule. Ang ligaments naman, siya yung nagbabind sa articulating bone together. While bursa, ito yung sac filled na puno ng synovial fluid. Nagka-cushion siya ng movement ng tendons, ligaments, and bones at a point of function. Okay? Familiar na sa synovium, ligaments, and bursa. Now, move on tayo sa skeletal muscle contraction. Ang skeletal muscle contraction. So, yung skeletal muscle contraction tayo focus ngayon. So, yung each muscle cell, or tinatawag din natin siyang muscle fiber, ay nagko-contain siya ng myofibrils. Myofibrils. na nagtuturn and nagko-compose ng sarcomeres and actual contractile units of a skeletal muscle. So, yung muscle cells natin, nagko-contract siya in response sa electrical. Nagko-contract siya sa response ng electrical stimulation delivered by an effector nerve cell at the motor end plate. So, the energy is consumed during muscle contraction and relaxation. So, yung primary source of energy ng muscles is, ano yung primary source of energy? Of energy ng muscle? Of muscle ay adenosine triphosphate. Muscle cells are ATP or adenosine triphosphate. Yan. Yan yung primary source energy for the muscle cells. At yung ATP naman kasi, nagja-generate siya through cellular oxidative metabolism. Nagja-generate siya through cellular oxidative metabolism. So, meron tayong isometric contraction and isotonic contraction. Ang isometric contraction, isometric versus isotonic contraction. Ang isometric naman ay length ng muscles remain constant. The length of the muscles remain constant but the force generated by the muscle is increased, pushing against immovable wall. While isotonic contraction naman ay characterized by shortening of the muscles with no increase in tension within the muscle. Example of this is flexing the forearm. Ulitin ko, ang isometric in short ay length of the muscles remain constant but force generated by muscle is increased, pushing against an immovable wall. Pero kapag isotonic naman is shortening of the muscle with no increase in tension within the muscle. Example nito is flexing the forearm. In short, kapag isometric, length of the muscle remain constant. Pag isotonic, shortening of the muscle with no increase in tension. Okay. So, ngayon, dito na tayo magfo-focus sa muscle tone. Muscle tone. Alam ko familiar na kayo sa muscle tone. Madalas to dinidiscuss. Ano yung muscle tone ng pasyente? Flaccid or spastic? Flaccid, miss. Kapag flaccid, ito yung okay, muscle tone tayo. Meron tayo 2 types niyan. So, relaxed muscles demonstrate a state of readiness to respond to contraction stimuli. Number 1, meron tayong flaccid. Pag flaccid, ito yung muscle na limp without tone. Ang spastic naman ay muscle with greater than normal tone. Muscle with greater than normal tone. Greater than normal tone. Okay? Pag flaccid, limp or without tone. Kapag spastic, sobra-sobra, greater than normal tone. So, meron rin tayong exercise, disuse, and repair. So, yung muscles need yan to be exercised to maintain function and strength. So, meron tayo sa muscle hypertrophy and atrophy. Alam ko familiar na kayo dito. Pag hypertrophy, Nagre-result yan pag increase in the size of individual muscle fibers without an increase in their number. Nag-hypertrophy yung muscle. Atrophy pag hindi nagagamit, for example, bedridden si patient, decrease in the size of muscle kasi hindi nagagamit. Atrophy, ala. Hypertrophy is increase. Okay? Yung the patient can decrease the effects of immobility by isometric exercise of the muscles of the immobilized part. So, meron din tayong quadriceps contraction exercise, tightening the muscle of the thigh, and gluteal setting exercise, tightening of the muscle of the buttocks help maintain the larger muscle group that are important in ambulation. So, ayun yung exercise, disuse, and repair. Always remember, yung muscle need yan ma-exercise para ma-maintain yung function ng strength. Meron tayong hypertrophy, which means increase in the size of individual muscle fibers, while atrophy naman is decrease sa size ng muscle. So, para ma-decrease natin yung effects ng immobility, binibigyan natin ng isometric exercise and quadricep contraction exercise. Ano ba yung isometric exercises and quadriceps contraction exercises? In short, yung quadriceps contraction exercises, ito yung nagtatighten ng muscle of the thigh, gluteal setting exercise, tightening of the muscle of the buttocks. Okay, tingin tayo ng example dito. Kapag isometric exercise, para alam niyo yung itsura. Ito. Immobile patient. Ayan, isometric exercise versus quadriceps. Type of strength training that is performed in place without the angle of joint and length muscle changing during contraction. Kapag quadricep contraction exercise, ano yun? Tightening the muscle of the thigh and gluteal setting exercises. Search natin. Quadriceps contraction. Ayan siya. Tightening contraction of a specific muscle or group of muscle during the isometric exercises. So, follow for part 2 MS Ortho. Ng details, specific plane of involved bone, reveal tumor, soft tissue or injury, or in short, CT scan. Yung patient must remain still during the procedure. Ayan yung itsura niya. In short, CT scan for computed tomography. Next is, meron naman tayong magnetic resonance imaging. MRI. So, yung MRI, non-invasive imaging technique to na gumagamit ng magnetic fields, radio waves, and computer to demonstrate abnormalities ng soft tissue.